And you thought you only had to worry about smile lines and love handles making you seem older. Well, think again. Your vocal cords are aging too, and age-related voice problems can begin as early as 50. But just like Botox can help you look younger, there are things you can do about your voice as well. Here with the story is WSJ reporter Andrea Peterson, along with Dr. Stacy Hallam, director of the Voice Clinic of Indiana. Welcome to both of you. Andrea, let me start with you. So what exactly happens to our voice as we age, and does it manifest itself differently in women than men?
Our voice tends to get softer and scratchier. It can actually conk out after a couple hours. You can actually lose your voice. Men's pitch actually tends to go up as they age. Women's pitch tends to go down.
Interestingly, I bet that is welcomed by a lot of women who are trying to always battle those high notes that we have when we're younger, right? At least that part.
There's one upside.
There's one upside. Now, Dr. Hallam, what scientifically is happening exactly to our vocal cords and to the surrounding membranes?
There's actually changes in the hyaluronic acid content, which cause the pitch in the women to go down and the pitch in the men to go up. So you'll notice when you're speaking to someone who may be in their 70s, their 80s, their 90s, it can be very difficult to tell if it's a man or a woman. And then the other thing that tends to actually be the most bothersome for patients is that they have this very breathy voice, very soft and breathy voice, and that is due to loss of the diameter of the muscle fiber. So the muscles actually start shrinking, and that causes a gap between the vocal folds. So when they go to speak, instead of being able to get a nice, loud voice that they can project across the room, it ends up being a situation where their voice is very soft and breathy. And it's just at a time where their spouses, their friends tend to be suffering from hearing loss. So it's a really bad combination to have the soft voice, the inability to get loud, and then in a situation where they're trying to communicate with people who have hearing loss.
Absolutely. And Andrea, you said that there are many new treatments now on the horizon, just as there are sort of skin treatments for aging.
Right. Well, currently there are things like there's actually injections of things, fillers like Restylane, Juvederm that we've heard that boost sagging faces. Doctors are using these to actually bulk up the vocal cords. Also using implants to actually be able to, so those vocal cords are able to be closer together.
Amazing.
Yes, but there's even wilder things sort of on the horizon. There's researchers in Japan that are doing injections of growth factor to actually regenerate the vocal cords. Dr. Hallam is doing some really interesting research on rodents where using a kind of muscle progenitor cells, which are kind of stem cells, to actually grow voice boxes.
Amazing. Dr. Hallam, tell us more about that, and also if there are sort of regular vocal exercises that we can all do at home that can help.
Absolutely. So we are very excited about the research that we're doing with the muscle progenitor cells because we think it's going to be highly translatable. We can actually take a muscle biopsy from one site. So in patients, we'll be able to take a little muscle biopsy from their leg. We can grow up those muscle stem cells or muscle progenitor cells, and then we can inject them into a different site. And if we inject them with collagen, we're finding that we have excellent viability of those cells, and it adds that bulk on a long-term basis. So most of our injectables to date have been just temporary. And so we're in the search now for a permanent injectable, and that's what we're hoping to develop with our rodent research. But it is at this stage just in rodents. And therapy for patients is always a great option. Patients often, as they age, they lose their voice more because they're not using it as much. So when they retire and they're not using their voice on a regular basis, it really is that saying, if you don't use it, you lose it. So the therapy gets them back more active in voice exercises, building up those muscles of the voice box, and can really make a big difference for patients.
Wow.
So that's always something to think about.
I think of those singing, those vocal exercises and acting classes and
Right.
singing. Are those
Well,
similar?
actually, singers don't tend to get these kind of age-related changes because
There you
they
go,
have-
because they're constantly using all levels of their vocal
Right.
cords.
I mean, sometimes
correct?
they have other issues with overuse, but
Right, of course. Now, tell me though, are there ever times when some of these voice-related or age-related changes can lead to or signify more serious health issues?
definitely. One doctor said to me, if you have a voice change that's lasted for more than 2 weeks, definitely get yourself to a doctor. I mean, these change in the voice can indicate cancer.
Okay.
Things like Parkinson's disease, also medication side effects. Drying medications like antidepressants, which are quite common, that can actually cause some changes.
So anything that happens dramatically and quickly should be checked out rather than slowly over time?
Well, I mean, they're saying if you have a voice change that bothers you that's lasting more than a couple weeks, you should at least get it checked out.
All right, great advice, Andrea and Dr. Hallam. Thanks to both of you for being with us today.